Hello, myself Vanita, dietitian from Chandler Hospital. As you see on the screen, the common question that we hear from everybody: I have a joint pain. Is my calcium low? Does a lack of calcium cause my osteoarthritis? Here I'm here today to just kind of bring in that differentiation. Does calcium deficiency cause osteoarthritis, or is it not linked to osteoarthritis? Before we go further, I just want to first let you all know what is osteoarthritis. Osteoarthritis is the most common wear and tear form of arthritis. It occurs when the protective cartilage, the joint's cushion, wears down over time. The disease is this is a disease of the joint primarily affecting the cartilage. It's not a disease of the bone density. So as you see on the picture here, okay, the cartilage begins to break down and there is eroding of the meniscus and there is bone spurs and exposed bone as well. Okay, because of which, okay, basically it is the cartilage begins to break down, which leads to osteoarthritis. It is more of a cartilage issue, not a bone issue. And this is your healthy joint where the cartilage is intact. Now, understanding what the importance of calcium role here. What is basic calcium role, not the importance of calcium in osteoarthritis? What is the basic role of calcium? Calcium is an essential mineral for life. Its primary job is to build and maintain strong bones and teeth. It is also vital for muscle function and nerve signaling. Calcium is not a primary structural component of cartilage. And I would like to kind of talk about the verdict given by Arthritis Foundation, where they say that there is no direct evidence that calcium deficiency causes osteoarthritis, which I also agree upon with their and I would like to stick on to that point here as well. Osteoarthritis, as confirmed earlier, is a disease of the cartilage, basically the joint cushioning. The risk factors can be seen during underage, okay, and obesity, joint injury, and genetics. The results are usually joint pain and stiffness. Osteoporosis, on the other end, is a disease of the bone because of the low density and weakened bones. Risk factors, basically when there is low calcium levels, low vitamin D, and because of age and hormonal changes as well, osteoporosis can be seen. And the high risk is usually you can see a lot of fractures in these conditions. Osteoarthritis, age. The risk of developing osteoarthritis increases significantly as you get older. Obesity is an added burden because it puts a lot of stress on the weight bearing joints, especially like the knees and hips, okay, because already there will be a wear and tear of the cartilage, and when you're additionally extra on your weight, okay, it will be an additional burden on your joints, which kind of makes your mobility very difficult. That's the reason ensuring that you're in your ideal weight, it is very important. And previous joint injuries or even from many years ago increases the risk as we age, and that also can be the reason for osteoarthritis. And genetics, some people have a genetic predisposition that makes them more likely to develop osteoarthritis. Before we go further on the diet aspects, I just want to add on about the calcium needs for bone health. Generally, for an adult between 19 to 50 years, it is 1000 milligram per day. Men between the age of 51 to 70, it is 1000 milligram. For women, especially above 51 to up to 70, it is 1200 milligram per day. For adults, irrespective of the gender, they again the requirement above 71 plus is 1200 milligrams per day. But why particularly for women above 51 we need 1200 milligram per day? The reason is after menopause there is low estrogen levels which causes to lose bone mass more quickly. Here, that's the reason higher calcium intake helps to slow down this bone loss. But always go by the doctor's prescription for your calcium dosage. Even after menopause, do not kind of follow your own prescription. Now coming to the most important point of discussion today, as uh, thought, uh, we are doing, okay, osteoarthritis. To keep your joint health good, what should be the major criteria when it comes to your diet? First important point is your anti-inflammatory foods. When I say anti-inflammatory, omega-3 fatty acids, foods rich on those can be helping you well to reduce the joint inflammation. From the fishes, we have the salmon fish. From the nuts origin, we have walnuts. And from the seeds category, we have the flax seeds. Generally, I would say if you're a fish eater, maximum once or twice a week, 150 grams per serving, not more than that per day. And if it's a fish, walnuts maximum up to 4 in a day and minimum of 2 with no case of any other medical conditions. Flax seeds, a minimum of 1 teaspoon per day and a maximum of 1 tablespoon per day with no medical conditions. But this is a general guidelines, but in specific based on your medical condition, the medications that you've been undergoing, always get a customized suggestion from the dietitian for yourself about the quantity of nuts and seeds that you could be including on a daily basis. Antioxidants are very important for all of us, and usually they are very rich and richly available in all kinds of fruits and vegetables. So how do I make my food rich in antioxidants? The simple way, we have the 7 colors in the rainbow. When you kind of visualize the vegetables and fruits as well, we have all the 7 colored fruits and vegetables. So pick any 2 colored vegetable and a serving of fruit every day. By the 7th day, you are done with all the 7 colored fruits and vegetables. This way you will be meeting up for your requirement of all the micronutrients for the day plus through the week, okay, and which kind of makes your food rich on antioxidants also, and your body will be able to fight oxidative stress very easily and keeps your joint healthier as well. The most important thing, maintain a healthy weight. This is the single most effective dietary strategy to reduce stress on your knees, hips and spine. Going on crash diets, eating less, adding on supplements, meal replacements, okay, does not help you. But following a balanced meal plate, going for complex carbs, and then balancing your right protein and plant proteins especially are more healthier when compared to animal protein. But if you include animal protein, what should be your serving size, frequency? Go for a customized guidelines again here. But always follow a healthy plate, which is a balanced meal plate. A tea plate method will be absolutely fine whenever you want to maintain a healthy weight. But the unforgotten vitamin that we need to talk about here today is vitamin D. As you all know, body cannot absorb calcium effectively without vitamin D. So vitamin D is very essential for us from birth until we are. So from sunlight is the best source of vitamin D. Apart from that, we have the fatty fishes, which includes again the best variety, that is the salmon, mackerel, sardines and tuna. And we have a lot of fortified foods as well. Do pick on them to catch up for your vitamin D availability. So I would like to conclude by saying that osteoarthritis is a joint disease and not a bone disease. Just by stepping up your calcium availability, you're not going to do good for your joint functioning and joint health. But follow a healthy diet, okay, exercise regularly. I have my friend who has given tips about what is the best exercise routine during osteoarthritis. Do follow her guidelines. Do follow our doctor suggestions for to keep talk about your supplements, what is required based on your age, what are the blood tests required based on your age. Do follow their guidelines and my pointers on the diet. Thank you.